Welcome to page 103 of Anatomy Coloring Book. This is Dr. Stephen Harkins. The chest area is divided into compartments, and we call these compartments the mediastinum. We divide it into the superior mediastinum and the inferior mediastinum. Here, this does not include the lungs. Taken the lungs out of this. And the inferior is divided into three portions. The anterior, the anterior, middle, and the posterior. The inferior border of the mediastinum is the diaphragm. Is the diaphragm muscle. There we go. The posterior wall of the mediastinum is the anterior thoracic vertebrae. And the lateral wall and the front of the mediastinum is the sternum and the costal cartilage of the ribs. And the superior mediastinum is fascia. And the lateral mediastinum is parietal pleura, in other words, the coating and the covering around the lungs. The structures in the mediastinum, first you can see in the superior mediastinum the thymus gland here, and also in the anterior mediastinum. We see the heart in the middle mediastinum. We see the aorta in the superior mediastinum. We see the thoracic aorta. This is the aortic arch. The thoracic aorta in the posterior mediastinum. From the anterior view, you see the heart, and inside its lining of pericardium. Pericardium is the sort of sac that the heart lies in. We see in the superior vena cava in the superior mediastinum here. We see the pulmonary trunk. In the superior mediastinum, we see the pulmonary artery. We see the pulmonary vein. We see the aortic arch. We see the thoracic aorta, which is looped from the aortic arch and then gone down behind the heart. Another look at the inferior vena cava. We see the trachea, and behind it, the esophagus, superior mediastinum. esophagus, trachea. We saw the thymus up here, anterior mediastinum. We see the vagus nerve in the superior mediastinum, and traveling down to all the organs and glands of the body for parasympathetic activity. And we see the phrenic nerve here innervating the diaphragm. So you can breathe, the muscle for breathing, and the phrenic nerve from C3, C4, and C5 allows the diaphragm to contract. See, the lungs are pulled away here. Being pulled away, the lungs are not considered part of the mediastinum. There's the vagus nerve and the phrenic nerve. The heart has a lining inside it called the endocardium. Endo means inside or within. And here's the endocardium, a thin layer covering the next layer, which is called the myocardium. Myocardium, myo means muscle. So you can expect this layer is the muscular layer of the heart, causing it to contract and to beat. Oops. Now this next layer, the pericardium, is very interesting. It is the outer layer of the heart. We won't make it red, actually. It's the outer layer of the heart here. And it's like a sac. So it starts, let's say, right here. This is what's called the visceral pericardium. The visceral pericardium surrounding the myocardium directly. And then the visceral pericardium becomes the parietal pericardium. It's continuous here with the parietal pericardium. And it forms with the visceral pericardium a sac. And inside the sac, the pericardial cavity in between the two. So it forms a fluid-filled sac surrounding the heart, called the pericardium. And then outside that, one more layer called the fibrous pericardium. Incidentally, peri means surrounding. Surround and cardium means heart. Surrounding the heart. And here you see it's attached, the fibrous pericardium attached to the diaphragm. If you were to grab a sac, and let's say the sac looked something like this. Let's say it was a paper sack, like that, and you were to grab it with your hands, and I'll do my best. And okay, let's say that's the hand. But let's say you were to push this sack over your hand so that your hand, let's say it was right here. There's your thumb. That's a really bad hand. All right, but you were to push it over, and assuming it sac wasn't filled with air or anything like that, you took the air out. The sac would wind up, you've got that little part here, the sac would wind up covering your hand like so. Assuming you pushed the sac over it. But your hand is not actually inside the sac. Well, in a similar way, so what it did is just fold it over and sort of enveloped your hand. And in a similar way, the pericardium, that's what the pericardium is. That's why there are two layers. And I suppose you could say the pericardium, you could say it's filled with, the sac was filled with fluid. Right? And we can call that the pericardial fluid, the pericardial cavity. And it's this fluid that allows a friction-free, the heart is pumping, 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 you know, beating and violently beating in your chest, you know, 60 to 120 times per minute, and higher with exercise, obviously. And this pericardial sac allows it to do so without friction, without rubbing against the anterior chest wall or the posterior chest wall. And so it creates a smooth, friction-free environment for contraction. This has been page 103 of Anatomy Coloring Book. This is Dr. Stephen Harkins.